I am Shannon Costine with the Modern Provider Podcast, and today we have Melissa Norris. Melissa, I'll let you introduce yourself.
Good afternoon. I am the founder of Credentialing Consultants of Florida, now known as TherAssist Practice Concierge. We help mental health and behavioral health speech therapy providers throughout the nation with their practice needs.
So tell me a little bit about yourself. How did you get started in the credentialing world?
I think I tripped and fell into it. It was definitely not something that I planned. I spent about 20 years managing mental health and nonprofit in Florida. So I started in 2001 as a Medicaid compliance specialist and then held operational management positions with compliance and leadership up until 2020. And about 2015, some of my friends wanted to start their own practice, and they said, "Hey, we're the therapists, you're the paperwork person." So I helped them get started and thought, I've been doing this for agencies, so I'll kind of start helping other people. What I thought would just be a little side gig that I did for a couple extra hours a week developed fairly quickly, so that in 2020, just as COVID was about to hit, I decided to quit my nice full-time job with
Oh my
benefits
gosh.
and launched this company full-time. So I'd been doing it double duty for a couple years, and it finally grew big enough. And just through my own experience with developing companies, developing programs within companies, and working on compliance and auditing and credentialing and billing and all that stuff, I just took what I learned and what I knew and turned it into helping support small and growing practices.
Do you feel like that's how you grew your business, was just knowing people from the industry, from
100%.
where you were at?
I think not even so much knowing people from the industry as much as having a presence and being able to answer those questions because I knew where they were coming from. And that is how I got started, even just reaching out to people and answering questions. If people
Yeah.
would say, "Oh, Melissa will know this," and they would refer to me. And from there, I just started answering questions, developing trust, building a group of people that wanted to work with me. And here we are.
What made you stay in the credentialing? What made you stay in mental health credentialing world?
Well, mental health obviously being my background and my history, even though I am not a clinician, and I make a point of saying that. I did spend time on the provider side, but I am not a treating clinician. I'm not cut out to be a treating clinician. Very much admire and respect mental health providers. So I do have a passion for mental health and everything that it offers to the world and to its clients.
Yeah.
And I like the idea of still being able to affect the mental health field. So that's one of the reasons why I have kept that niche. Certainly just because that's where my knowledge and understanding and experience and comfort level is. But I did attempt to branch out and start working with some doctors when I first started the position. And just a different kind of provider. Everything about them, philosophically, operationally, and I just went, I can do this with a mental health niche and focus, so that's what I'm going to do.
Uh-huh.
And the only thing that I expanded into was, of course, behavior analysis, because so many of the contracts can cover both mental health and behavioral health, and carve outs handle both of that at all. They tend to fall in the same lumping, if you will. But we've also added speech therapy, and we do credentialing for speech therapy because quite often you find those organizations that do both. So since they do both, then I want to be able to help them with all of their needs within an organization.
Can you explain those carve outs a little bit or how that works? You're helping people with that?
Yeah, so when you've got any provider who wants to be contracted with the insurance company, they of course need to know who's going to pay them and who's going to write the contract. So your members, your clients, or your patients, if you will come to you with a card that says Florida Blue, or that says, and you continuing to use some Florida examples that might say Simply, but back when the history of it is that back when the Mental Health Parity Act was launched, we had a lot of insurance companies that did not pay for mental health. And you might have mental health, you might have medical coverage through work or whatever, but mental health wasn't covered. So the Parity Act came and said, no, you gotta pay for mental health. So I see this as if the medical payers are petulant teenagers and they went, fine, we'll pay for it, but we're not going to manage it. I'm going to hire Lucette to handle it. So Lucette is the behavioral health carve out or the behavioral health arm for Blue Cross, as well as many other Blue Cross in Florida, as well as many other Blue Crosses throughout the United States. So that's what we refer to as a carve out. It's that subcontractor that handles the management and the contracting of providers that want to provide mental health services. And you see that nationwide. Some insurance companies will maintain all of the mental health management within their own walls. Some of them pass the buck and subcontract with an organization that maybe is better suited to handle the management of mental health.
So they're all allowing for those carve outs currently, or no?
What do you mean?
All the payers. Are all the payers allowing for the carve outs in the contracts?
Not all the payers have carve outs. Many of them do. But everybody now pays for mental health, whether they pay for it on their own. Cigna does use Evernorth, but it's the same company. Aetna is an example. If whether you are a podiatrist or a psychologist, you just go to Aetna and say, I want a contract. And they look at which department you would belong in and they cut you the right kind of contract. But if you go to Blue Cross and say, I want a contract, and here in Florida specifically, they're going to say, okay, well, you need to go talk to Lucette, and Lucette will give you the contract. So you just have to know which plan you're looking for. And if a provider comes to me, say from a state that I've never worked in, that's the first thing that I do is I go to that website and I Google, or I search their website rather for behavioral health and mental health. And by poking around a little bit, it will reveal to you whether or not they handle their own contracting and management of the mental health providers or whether they carve it out to another organization. And then that guides us to knowing who we need to work with to get contracts.
Do you find that's the most easiest? I know we get that question a lot in the group.
To go just go find it? For me, yes. Now, I am a natural troubleshooter, and I think that's what's really helped me in my role as well in developing that trust and preparing for trainings. I am a problem solver, a troubleshooter, I'm an investigator, and that certainly lends to my being able to find that information quicker than maybe some other folks might. But I don't save any applications on my computer. I don't save forms on my computer because I find that they upgrade, they change, they get edited very frequently. And by saving them, even website links, I save some, but so often I'll go to click on that link and it gives me that this page address has changed. So I now know that I have to go find the other website. So for me, with few exceptions, if I'm looking for joining a network, just going to the website and, Blue Cross Utah, join the network, mental health. And that's what I'll type in. And in 99% of the cases, it takes me right where I need to go.
That's a great point because so many people do have a long laundry list of, places with the links saved.
Mm-hmm. And I have
But
some,
you're right.
but so many times they change.
And they're constantly changing. What do you feel like the biggest difference is with mental health versus everybody else, versus any other specialty?
From a
Credentialing standpoint or enrollment
standpoint, I feel like and maybe they don't, but I feel like they take longer for mental health. I feel like they being the insurance companies or the credentialing teams do a lot more digging. Maybe it's because we have not hit the doctor level yet. I'm sorry.
You're okay.
Maybe it's because
We're doing the same thing.
Well, this is the joys of working from home, right?
Absolutely.
So there's maybe a lack of I don't know where it comes from, but maybe it's a lack of respect or a lack of acknowledging that their master's degree very much has earned them the place to be in your network. But doctors, we can usually get on board a whole lot quicker than mental health providers. Even when we do work with psychologists, I can get a psychologist enrolled much faster than I can get a mental health provider enrolled. And there's not a whole lot different. There's nothing different the way I'm doing things outside of, doing the right application. But I think the plans just seem to have a way to onboard them a lot quicker so I don't know what it is because it's on their end. Like, why is it taking that long? I
And
don't really know what.
it's so much less documents and credentials
Yeah,
for them. So it's interesting
yeah.
that it's less that they have to verify. So I don't know why it would be longer, you know?
That's what I would think too. And I don't know why it takes, but in my experience, I definitely can get a psychiatrist loaded and onboarded with an organization. And I think there's maybe a more of a shortage of psychiatrists, so that whereas there's not with mental health therapists, so maybe they prioritize
That's a
a
great point.
prescribing physician over a non-physician. I don't really know.
Yeah, no, that's a great point. What does a typical day look like for you in a business owner world?
Well, some days I come in and I get to sit back and, just relax. Yeah, that never happens. I think,
Sip on your Mai Tais at the beach with
exactly,
your feet up.
right? Every day is so different, which is part of the reason why I like it, because it's not like going back to the grind again. I almost never
Yeah.
know what's waiting on me, which can be a good thing or a bad thing, right? There are some days when I feel like I'm being pecked to death by chickens, because I've got people coming at me from every angle, and some days where things are running smooth. I mean, I love the time that I get to spend training with clinicians, either clinicians or their office staff. They'll come to me and ask for guidance, whether it's show me how to use my EHR, or help me
Oh,
figure out why this credentialing is messed up and what I need to do to fix this. And I do a lot of that one on one, and I enjoy doing that. So some of my days are filled doing a lot, doing that really hands-on work with clinicians. Some of my days are filled supporting my team at supporting their providers, whether
okay.
it's finding new information and educating them on how to do a new application, or where to find stuff, or policy changes. And then unfortunately, as a business owner, some days I'm putting out fires left and right. And you're never going to make everybody happy. And whether it's my age, my experience, what I finally learned that. And I take my job very personally, because it's my baby, it's my company, it is my reputation. But at the same time, I know I can't take everybody's response or everybody's approach to me personally, because sometimes it's a lack of understanding, sometimes it's they might just be having a bad day, sometimes somebody on my team screwed up and I have to address it. So, and I'll own that when it happens, and I'm going to address it and get it taken care of. But I really want to try to minimize that from happening.
As much as we want to say it's the provider's fault and we want to put the blame, it took me a long time to take not take it all personal. Might still be learning
Oh,
that.
yeah. Oh, yeah.
But
Definitely
it's
have those
hard.
days.
Yeah, it's hard in the business world. You're constantly have things thrown at
Yeah.
you. How did you learn, or how are you keeping up with industry trends?
I do a lot of reading. I am probably on every mailing list that you can be on, from the different insurance companies to other other professionals in the business. I get Danielle Kepler's newsletters and Barb Griswold's newsletters, and being part of Facebook groups. And I know, socially, Facebook is starting to go away a little bit. Socially, there it definitely has its pros and its cons, but I have to say, professionally, in what we do here, I have found it to be a huge support, both from networking, to gain business, as well as share information. And I still learn every day, and I will probably, maybe once a week, every 10 days, I see something posted on Facebook that teaches me about news that maybe I haven't seen yet,
Yeah,
industry changes, something new that's happening. I'll screenshot it, send it to the leadership within my company, and say, "Hey, we need to look into this." And then I'll go find the policies, or maybe I do have that email, I just haven't read it yet, so I'll go find that, and then we start to integrate that into our what we do.
that's nice. Yeah. Is there any certain newsletters that you would recommend, like one of your favorites?
Well, hopefully by the end of the year I'll be able to say it's ours. But I haven't I haven't necessarily, I mean, from a billing perspective specifically, I mean both Barb and Danielle have great newsletters. I look for newsletters that are informational and not necessarily just trying to get my business. And that's what I hope to put out.
Oh,
The newsletters that come from the insurance companies are the best because it gives us their policies and their policy changes, and I haven't yet found the one that necessarily is it compiles all of that, and that's what I'm hoping to do is compile all the ones that I get into like one big newsletter,
oh, that's awesome.
and kind of put that out. So if there's one out there, send it my way so that I can also kind of follow along. But that's what I'm hoping to do. Don Self also has some great things out there. And he's also very billing focused. So I think maybe there's a lot more billing type newsletters out there than there are practice management or credentialing newsletters.
I did see him on LinkedIn. He puts out some really Don's puts out some really great information
He
on
does.
billing. I learned a lot about Medicare. From a billing aspect of how Medicare works, but his is really educational.
Yeah, very much so.
And there's a lady named Jana that puts a lot about NCQA, industry trends on
Really?
NCQA.
Okay.
I'll have to send you that one. That one's obviously not billing or enrollment, but it's still interesting to see what changes and trends are coming
Absolutely.
in the industry.
Yeah.
What do you feel like are some common challenges or trends that you're seeing in the industry or some things that you're facing?
Some of the things that we're facing, the insurance companies are really becoming very hands off. Whether it's because they're
Really?
trying to automate things, and I don't mean hands off as in they're not trying to control stuff because they're trying to control everything under the sun. But
Sure.
I feel like there's less and less opportunity for us to talk to a human being. Number one.
Yeah.
Number two, if we can talk to a human being, they're in a call center. Maybe the call center's here, maybe it's overseas, but we often find that there's either a training barrier or a language barrier because it's a basic call center, not somebody with an expertise. And if I have a question that I really need, I've done some digging, I've done my own troubleshooting, I've done my own problem solving, and I just can't get to the answer, or I need to escalate something, that's where I'm running into some significant issues. And nationwide, our providers are seeing that with TRICARE right now. I mean, that's just a hot mess with their changeover that they've been going on with their management companies and with who processes their claims. We're seeing that big time with Aetna. I used to have a contact with Aetna. Now I knew I could only reach out to her if we really had hit a significant issue, but she would be helpful. She retired, and since she retired, it's been very challenging to find somebody that is as communicable. And I just keep getting passed to their call center who will just say to me, I can't give you a supervisor. And all they're doing, I can tell they're reading from a script when they talk to me. So they're not actually answering my questions. I don't want them reading from a script. I want you to help me troubleshoot. So we find
Sure.
that, I think that's a challenge. And the time frame that it takes just to get some of this stuff done. I mean, on our end, on the credentialing end, we're very limited. We can do our best job and cross every T and dot every dot I and submit a perfect application, and then we're at the mercy of the insurance companies. So the challenge comes in that we're already frustrated. We already know that this is taking a long time and we can't get a hold of somebody, but maybe the providers don't understand that. So now we're also dealing with the providers getting angry with us, thinking we're not doing our job right or we're not doing an effective role. And it comes down to it's because I can't talk to a human being at the insurance company, and they're just putting your application through some type of automated system at this point in time.
I say every provider should have to call and follow up on their application
At
and
least once,
see
that would be great.
what the process looks like,
I have had to do three-way calls with my providers because some plans worse than others. You call them, you could talk to four different people and get four different stories. Whether
Yep.
it's four different ways of doing things or four different statuses on your application, which how can you have four different statuses on an application? And I have had providers that have reached out and said, I called that company and you're lying to me. And I have said, let's pick up the phone and we do a three-way call and I ask different questions and I know to push back. And I am
Sure.
able to say, here's your reference number. And I talked to this person, this is what I was told. And then we come to the bottom of, oh yeah. And then when we hang up the phone and the provider's like, oh, Yeah, that
That's
was a
great
mess.
advice.
And I said we do that every day, day in and day out. And when I hire staff, they got to have a thick skin because of that.
Yep, absolutely. That's great advice, though. Put the provider on the phone.
Yeah.
Hear what we're hearing
Hear what we're
because we do.
doing. Yep.
Yeah, because we do get different answers all the time, you know?
Yeah.
Have you seen any? We're seeing a lot of AI being introduced. Have you seen that at all on the insurance side?
You mean from the insurance companies or from the
Yeah, from the
provider
insurance
side?
companies.
I mean, I know it's out there. I don't give AI a whole lot of my time because I really don't like its place in mental health. So, I think we're going to see more and more of it, but
Yeah,
I haven't paid attention to if it's being pushed from the insurance companies. I'm seeing it
or if
being
they're
pushed
utilizing
from
it.
billing companies, and I'm seeing it being pushed by some of your larger VC companies saying, use AI to take your notes and to report this or to report that. And I don't like it. I know that AI is being used on the authorization side of things when insurance companies are deciding whether or not to pay claims. And that has
Really?
caused some of the denials to increase. That's why we might have to see more of the peer to peers when we're trying to get prior authorizations because AI is just kind of automated. The right word wasn't in that authorization request, and therefore it's getting kicked back.
Yeah, it kind of scares me a
Yeah.
little bit to see what it's going to do, especially if you start introducing AI into applications.
Yes. Yeah.
How right is it really going to make it? You
Agreed.
know?
Because yeah, I mean, you can pull up anything on Chat GPT. I can't talk today. On if you go into the Google and their AI system, and it's mostly right. So,
Yeah.
if and sometimes it's mostly wrong, but, I, with my GPT account, when I used it this morning and I did something that I knew I literally put in there, how do you do an application for Optum? Because I was curious and see what would come out. And it was
Oh,
pretty generic. It was right. I mean, the steps were right. It was very generic. There's some nuances that it didn't cover. So I then wonder if we're then going to take that. I mean, this was just a step by step guide on how to do an application. So I then wonder if it turns into fill out this application by AI, it's going to be that same thing. It'll be mostly right. But as you know, if an application is mostly right, that can still be disastrous when it comes to trying
absolutely.
to get paid. So I don't know if we'll ever get to the point that it's completely right, which means we'll take on more of the people complaining.
Well, it's just like when you map a form. You map a form, but it's not completely all right. You have a person, a human, that has to go back and check that to make sure
Yes.
it's accurate
Yeah.
before you send that off for signatures. AI is going to create the same thing.
Well, yeah,
You think
exactly.
AI is going to do everything accurate? It's not. I don't think
Right.
it's going to. But how has technology influenced credentialing in your business, or has it?
I mean, I definitely think it's made things faster. The ability to go onto a website and fill out an application and just submit it on the website is so much better than having to print and sign and upload and all that stuff. And rarely now do we find, I mean, even when I started, 9 years ago, I guess was really 2016 is when I started my company, but I was doing credentialing long before that. And back in those days, I mean, it was paper and you had to fill it out by paper and sign it. And whether you could fax it in or email it in, or there's still now some places you have to mail things in. So we got a lot more of that
It's
then. So
crazy.
I think, yeah. So I think the number one thing that technology has helped with is timing. We still do everything very manual in my company, but at least it's still online, so it's still faster. I can sit down now and knock out a Florida Medicaid application in 10 minutes. I did it last week and timed myself because I was curious.
Oh my
So, but I've been doing these for a very long time. So, but it used to be that I had to do the application and then I had to fill out every single piece of paper as an attachment, and then I had to print it, and we'd had to have them hand signed, and then we had to upload them, and it took even on my best day, at least 30 to 45 minutes to get it done just because of all of the extra paperwork. And now almost every bit of that has been automated. So that's a huge help. And I think really with most insurance companies, we are seeing that. There's not too many forms anymore that I have to download. Talking to you, New York Medicaid rather, is multiple forms and you have to snail mail it on top of that.
I just heard that New York and California, I believe, is still snail mail.
Some things with California are still snail mail, but not all of it. But yeah, they're much more particular though about who can also be enrolled.
And wet signatures.
Yes.
Gosh.
Yeah. Florida's still a stickler about wet signatures too. For the most part, I can usually get past it. I have just a stylus pen that we can formally, physically sign on my screen. So usually that will work. Every once in a while it won't. But I mean, I sometimes think they spend more time investigating whether it was a digital signature than they do actually reviewing the information for the applicant.
How about we run the background checks and check and see if the provider's legit and the
Right.
license is accurate, and
That would be
stop worrying
nice.
about
Yeah.
the signature to make sure everything is accurate.
Exactly.
Yeah. What advice would you have for healthcare professionals or organizations looking to streamline their credentialing process?
Patience. The fewer
Great
people
advice.
that are working on it, the better. And I don't mean overload your few people. I mean have one person working on one project or one person working on one applicant. Because when you get too many people involved, you have a cross of information. The insurance companies actually don't like it if they don't know who to talk to either. And we always want to keep them happy so that we can get our applications in a timely manner. Definitely, if there's a system that works for you, find one. By system, I mean, find something like, QGenda or what is it? Credential MD, Credential My Doc. And I spent a lot of time looking into those. And when I last looked, was unable to find one that was economical enough for my company. But if you are
Sure.
within a system where everybody's coming up under your insurance, under your company, and you're hiring everybody under you, and you're doing credentialing internally, whether it's a hospital system or a clinic system or something like that, definitely use what's available to you to make your job more efficient. If there's something out there because the manual stuff just makes it more difficult. I mean, that's number one. And organization, definitely, make sure that you're being extremely organized and tracking everything.
Are you currently on spreadsheets?
I am.
And that's where you're tracking demographics and
Yeah, we
notes and tabs.
it is. We have a portal where we collect our demographics. So all of our providers have to go to our portal and fill out their demographic information, whether it's about themselves as an individual or the business. And then we transition everything into the spreadsheets. That's where we track everything that we have going on. We are building with Salesforce. It is taking way longer than I had hoped. We are going on year 2 and we haven't launched it yet.
No.
So we're getting there. Hopefully this summer we're this close. Literally, like I gave my final approval last week, so I'm waiting for them to say okay, we can pull the trigger. And that right now is going to be primarily demographics gathering and communication. The long term tracking is going to probably have to continue to be built out. But like I said, I interviewed with. I looked at. I think everything out there that I had heard of at the time. And because of the way the other organizations charge, they were basically charging per provider or per tax ID. So right now I have about 1,000 tax IDs. And under each tax ID, I have between 1 and 75 providers. So when they were charging me per tax ID, I'm like, that's 2 salaries a month that you're wanting to charge me. So I said, we'll keep using our spreadsheets until
Back to my spreadsheets.
Yes, we'll stick with that. I'm a small growing business.
Yeah, completely understand. But sometimes it works, you can keep everything really organized in there. That's what we tell people when they come into the group. If they're just getting started, we have those spreadsheets up there. in the file section for them, which leads to my next question. What advice would you have if somebody wants to start their own business and just getting started? Don't do it. No, I'm just kidding.
Maybe. Learn. I mean, take time. Take time to understand what you're doing. I think that we both, from people maybe trying to start their own businesses and on the provider side, people think all we are is paper pushers. Oh, they're just data entry, but we're so much more than that.
Absolutely.
Yes, data entry is great. If all I was hiring was data entry people all day long, I'd be fabulous. But there's a huge difference between I can fill out a form and I understand what I'm filling out. And filling out the
Sure.
form is the easy part of our job. So my advice is understand what you're doing, understand why you're doing it, understand how it affects your providers that you're working with. Yes, it may be giving you a paycheck, but are you doing sufficient work and excellent work that's also helping your provider grow and develop their business? Because what we are doing is so paramount to our providers being able to operate their business. And understanding that, I think, will help with a business owner's internal motivation, hopefully, that
Sure.
they're motivated to understand why they're doing that. Number two, kind of like we started at the beginning, is keep your ear to the ground on what's happening, developments, new things, changes in EHR systems, changes in technology, changes in policy, and it takes a lot of time. You have to stay on top of that.
Yep.
It's not just about getting clients. It's about getting a client and doing a good job. And I'm sure you have experienced similar to what I've experienced, where people have hired credentialers and gotten burned hard, either because that person didn't know what they were doing and just messed up all their applications, or whether they took their money and ran and thought, oh, all I have to do is do paperwork. What we do, it's not about the paperwork, it's the backside. It's the follow
Yeah.
up. It's the make sure things are happening. It's developing those relationships with the insurance companies. It's being confident to be assertive when we have to be and push back on the insurance companies. When I call Aetna and they tell me, well, it's X, Y, and Z, and I know darn well that it's A, B, and C, I'm going to push back politely and appropriately because I'm confident that I know what I'm doing. And
That's a
and
great point.
I'm gonna push back on that, and I think that's what's helped me become successful is I have that knowledge and understanding. I'm not just looking at this as, oh, I'm just filling out your forms for you.
And you've been able to deliver results because
Exactly.
you're pushing that and you're following up.
Yeah.
And you're right. There's so many people that are just submitting the application and waiting for the contract to come back and they just sit on it. I saw one recently that they said they've been waiting for a year for something to come back.
Yeah.
That's crazy to me. Like,
Agreed.
have you followed up? Have you called?
Yeah.
Have you? I'd be calling them every week.
And
You
that's,
know?
my staff knows that I have some relationships with higher ups and some insurance companies that I won't share. I won't share that with anybody because I
You've
developed
developed
those and I
those.
worked hard to get them. But
Sure.
there's a whole lot of people in between. And I teach my staff to be that assertive person, be that squeaky wheel, push, escalate. And if it gets to a certain point where you felt like you've escalated and it's not going anywhere, then I better be made aware of it because then I'm going to push it higher and we're going to do what we need to do. And I will say, as a company providing that service to providers, nothing irritates me more than finding out one of my own internal team who knows I will have what I call a professional temper tantrum with an insurance company, where the provider says, well, I've been working with, whatever, Joey, and we're going on month 7. And I'll be like, Joey, why am I not aware that you're at month 7 on an application that should have been done in month 4? Because if you've hit that point, you should have escalated and then reached out to me. And that's what I say, let me have the professional temper tantrums because I'm going to be the one that gets demanding with the insurance company if we have to be. And
No, it's
and
fair.
I keep it professional, but they know I have my expectations. And I mean, I think that comes from being in the trenches again. Before
Sure.
I one time Optum owed my organization $250,000. I had almost 200 clinicians that we were responsible for their paycheck, not to mention my support team. And the CEO of Optum heard from me, and I went out
Good for you.
there and I found everybody. I found their legal team and their provider happiness coach, whatever they call their VP and their CEO and their CFO, and every single one of them heard from me, and we got paid. But it took some time. It took some escalation. It took them making promises that they didn't come through on, and then I just finally said, all right, I'm done. I'm done giving y'all a chance. I'm going as high as I can possibly go. And that's what I offer to my clients too, is if it gets to that point, that's what we're going to do. And I will be involved. But unfortunately, it shouldn't have to get to that point, and it does.
I agree.
Regularly, it gets to that point.
Because of the insurance companies, that's what they're doing to us, which is crazy.
Absolutely.
How do you find those people? Like when you have to escalate or you need to go to the top? How do you find those contacts?
Start with a general search. I then go to LinkedIn. There's also some websites that you can generally find. They're usually like watchdog websites that are like, here's the information for the head of United Healthcare, and look at how much they're getting paid. Those types of things. Like, they should be doing a better job. But hey, if it serves my purpose of finding contact information, that's where I'm going. And I mean, I will just dig. I will dig everywhere I possibly can. Going to even some of the group pages. Aetna, we found Aetna's social media page will get us better results than calling their customer service line. So that's was
great
helpful
information.
For a while. Yeah. Go send them a DM through Facebook or Twitter, and somebody will respond and get you assigned. That I will say that's dropped off a little bit from success, but for a while it was super successful. I think people are starting to catch on to doing that. But if I really have to target somebody, I just start digging, and it might take me, an hour, but I'm going to have a compiled list of possible emails. Other things you can do, if you just can't find something, most companies have that same exchange, the what comes after the @ in an email address. Mm-hmm. So like mine's at Credentialing Consultants. So if you take anybody's first name at Credentialing Consultants, that's how you find my staff. So I'll do the same thing. And using Florida Blue as an example, I'm going to look and see what their email exchange is. I'm then going to go to their list of leadership. So even if that actual email address isn't there, I'm going to write an email to every possible variation using the at Florida Blue example. So if it was, Melissa Norris, I'm going to send an email to Melissa.Norris, Melissa Norris combined, M Norris, Melissa N. I'm going to send it to everything that people possibly use. I'm going to get a bunch of kickbacks, but I guarantee one of those is going to make it to the person I'm trying to make it to.
Smart. And you've got results.
I will find you if I have to find you.
Were you in law enforcement before?
I know,
Were
right?
you a detective?
Not in a bad way. I will do it from the other side of my computer. I am not visiting anybody, but...
Oh my God, that is fantastic. But it works. It
works, yeah.
It's like if you have a complaint on someone on Facebook and you tag like a restaurant or someone, you should be able to do the same thing for insurance, right?
Absolutely.
And if it works, then why not? People start tagging insurance. If you're listening, tag the insurance
Please,
company.
do what we have to do to get that out there. And I think it's been helpful with me, though, because I always approach, almost always, I try to always approach them from a positive side. I'm here to advocate. Sure. And that's what I see my role as when I'm having to do that, is I'm advocating for our client, not our provider clients as much as even our members. So that's when you approach a CEO or CFO or something of a company, I'm taking it from that angle. Like, you've got a lot of members that would benefit from this client. And, maybe they've asked to see this client or this provider or whatever. We need to work together. How can I advocate with you? And that has been a very successful tool that I've used. I've developed a great relationship with Sunshine, and Sunshine has plenty of haters in the state of Florida, but I am confident that when we are running into issues, I can reach out to my contacts there. And we've had off-the-record phone calls, we've had on-the-record phone calls, and this is the piece that I love, they've reached out to me at times when they have a large message that they want to get across. And it's how can we work together to get this message across to, and mostly, like, I have a Medicaid Facebook group that specifically was designed for Florida Medicaid. So certainly that's Sunshine's audience. So they'll, we've worked together. We've done lives with them. I've passed on messaging on their behalf. And that's what I would love to see happen. But we have to have the right players in every insurance company that's willing to do that. And I will say Sunshine's been the best at being willing to do that. Now, are they perfect? Absolutely not. And I will also call them out in a heartbeat. But it's nice to know that they're willing to listen and they're willing to try and work with their providers.
It does take more collaboration, and I wish that we saw more of that. And that's what I keep saying in the Facebook group. I'm like, we've got so many of us in here. Why couldn't we get more collaboration from these people? Maybe it's going to take more of us, more of Melissa standing and saying, talk to us, listen to us, Hopefully one day we'll get there.
I think so, yeah. And it takes doing it right, too. I mean, if you attack the insurance company, they go into the immediate, on the defense immediately. And I don't ever want to approach them that way because I want to develop that collaboration. Because if I attack them, they might help me today, but they're not going to help me next week when I have another situation. So that's the other thing that I really emphasize is, you've got to have some decorum when you are having that's where the professional part of my temper tantrums come in is, I am going to be demanding, but I'm going to do it professionally and with decorums that we are developing a relationship.
What's been the most rewarding, you feel like, of running your own credentialing business?
I really like when I consult with providers and they're able to say, I get it now, or you've helped me to untangle that. I love being a problem solver and educating people. I actually, my degree is in teaching. And I was very misguided when I thought I could be a kindergarten teacher. So I did that for 5 years and went, I can't do this anymore. And here we are, right? 25 years later.
Now you're teaching doctors.
Exactly. So now I'm teaching providers and I do enjoy the teaching still. So I did say, okay, maybe I wasn't that misguided. But, and when they've come back and said, you helped me get my business back on track. Because, something was happening. I wasn't getting paid. Now it's fixed. I love that. I love giving them the tools to have a strong and growing business. And when I hear that that's where I've helped somebody, whether it's correcting one problem that they had, that they, unknotting one knot, or whether it's absolutely sitting down with them and spending an hour a week for 6 weeks and helping them get on the right track and develop their company, that's what I enjoy doing.
Is that part of your business plan for your clients? Do you do like hourly with them, or do you charge per provide or per application, or how do you do it in your business model?
So for credentialing, if they're just paying us to do the work for them, they're saying, here's my information, go do it. That's a flat rate. And I've tossed that back and forth. And I know in the industry, there's a lot of conversation about, should I do this flat rate? Should I do this hourly? I started out doing it hourly. I honestly feel like I got more pushback hourly than I get when I do flat rate. But then everything beyond that is hourly. So training, consulting, troubleshooting, anything like that, they're just asking for extra support. That is hourly. And that includes our billing services. So when I rebranded as TherAssist Practice Concierge. And that concierge piece, I say just like when you go to a hotel, you've got the concierge downstairs. You can use them if you want them. And if you don't, you don't. And that's what we're here for our providers. You can use us for what you need us. We do file review. We do pre and post audit support. We do compliance trainings. And then, of course, we do billing review, billing training, setting up EHRs or teaching people how to use their EHRs. All of that falls into what we do from a compliance piece. We talk about growing your practice, hiring, firing, performance improvement plans, what you need to have in your business based on Department of Labor and IRS standards. So I do all kinds of different consultations on that. So it's kind of the gamut. The one thing that we don't do is marketing. I am not good at marketing, so I certainly cannot teach somebody else how to do marketing. And I'm also
It doesn't sound like you've had to do
people.
marketing.
What's that?
It doesn't sound like you've had to do any marketing.
I have been very lucky. I haven't had to do much, but and I've had people come to me. I'm also very honest and upfront. Like, most of what you're getting from me is lived experience, but backed by backed by evidence. I mean, I'm going to give you, if I advise you that, oh, that should be a W-2, not a 1099, I'm going to give you the resources from the IRS that explain this. And if you want any more deeper information, I'm also going to refer you to an HR specialist or
Yeah.
an attorney. I mean, I make sure everybody understands, where this is coming from, what my limitations are. But what we can discuss, I'm a researcher, so I've got the stuff at my fingertips.
Are you still helping other specialists learning other systems, like teaching them Medicaid or teaching them how to
I'm
use
doing a little bit of that, and I do want to enhance that more. I have enjoyed doing that, and I've recently gotten some requests to do that. That is on my to-do list for this year, is trying to launch something that's specific to other credentialing specialists. So that I can help them with their role, and that'll look a little bit different than when I'm helping a provider. I mean, if I'm helping a provider,
Sure.
I'm teaching them for their own little company. If I'm helping a specialist, I'm teaching them to grow their business, and ultimately, if you look at the con side of that, to potentially take away my business. Not that I'm not one of those competition type people either, so I'm not big into that. But I would like to be able to help mentor and teach other specialists.
That's awesome. I love that. I don't think that I have any other questions for you other than where can people find you?
They can find me at TherAssistFL for Florida.com or Credentialing Consultants of Florida with an S.com. It takes you to the same website. You can schedule time with me on there. I always offer everybody a free 15-minute call. Most of the time they're with me, but anymore, not always, because we're getting quite a few. So I have a couple leads that help me with those. But if there's somebody that really needs to have a specific conversation with me, there's a note section when they ask, and they can indicate that in the notes, and we make sure it goes into my calendar, and we get something scheduled.
I love that. Thank you so much for joining us
Thank
today.
you
We
for
appreciate
having me.
you.
It's been great. Thank you. I appreciate you because you've asked all the questions. I at least have to put this out there that I tell every one of my employees when I hire them, whether you like Facebook or not, I want you to create a Facebook page. You can put a cartoon as your user, and I want you to join this group because I
love
continue to
that.
learn so much from this group. And there are times when I will say, you need to go to the Credentialing Collaborators group and see if there's anybody in there that's asked this question. So thank you for what
Thank
you have
you.
offered.
I really appreciate
Absolutely.
that. Thank you. We'll talk to you soon.
All right. Bye, Shannon.
Bye.